first of all, welcome everyone to our webinar for tonight. Okay, tonight what we're going to share with you is top 3 secrets of diabetes version 2.0. Why is it 2.0? Is because we have done probably almost more than 100 health talks, okay, in the past one whole year of year 2020. And moving on to year 2021, we are improvising, and okay, we are getting better in what we are doing. And therefore today we want to share with you this version 2.0. And not only that, the secrets that we share with you are the secrets that your doctors most likely haven't shared with you. Okay, why do we say that? It's because if they have shared with you, probably you are not taking any medications anymore now, or probably you are also not even on any insulin. We notice someone is actually on insulin. You are asking whether is it reversible or not. The answer is yes, it is reversible. Okay, provided you get a professional to do it for you. And of course, today, other than the top 3 secrets that I'm going to share with you, we are also very honored to have our special guest, Mr. Simon Satya. All right, so he has been with us for the past about 2 months, and today he will share his life story, okay, with us on how he is reversing his condition, not just diabetes but also hypertension. Okay, Dr. Jasmine.
Yeah, and we are from Sweet Lives. Sweet Lives is Malaysia #1 reversing diabetes center. By prescribing low-carb, high-fat diet, we help patients to reverse diabetes in 6 months with a success rate of 82.3%. In just 3 years, Sweet Lives has helped 156 patients, and now it's almost 200 of them, diabetic patients, to get rid of medications, insulin injections, and supplements safely. Now, the first questions that we would like to ask, so this is a very interactive webinar here. Okay, that's why we want to let you focus. And the way that you stay focused is to answer our questions. Okay, one of the way, of course. So question number 1 is, most of the treatment we receive focus on number 1, symptoms or root cause. If you think that most of the treatments we receive focus on symptoms, please type 1. Okay, or if you think that most of the treatments we receive focus on root cause, you may type 2. So most of the symptoms we receive focus on symptoms or root cause. Yeah. So if you think that it is symptoms, you may type 1. If you think that it is root cause, you may type 2.
So this is irrespective of whatever kind of treatment you receive. It could be a conventional kind of treatment, like it could be Western doctors like us, all right? It could be even a traditional Chinese medicine. It could even be BOMO, all right? Okay, or it could even be, I don't know, any form of treatments, like alternative treatments and things like that. If you realize most of the time you receive, the treatments that you receive are focusing on symptoms, please comment 1. But if you think that the treatments you've been receiving is really focusing on root cause, please comment 2, all right? Wow, we have many answers. All right, thank you so much. Thank you so much. Okay, let's keep the answers coming while we explain what is the difference between focusing on the symptoms versus root cause. Let's move on.
Right, let's watch a video.
Nobody's gonna know. Nobody's gonna know. They're gonna know. How would they know?
Right, from this video, what can you see? The lady is actually taking the green paint and spray the yellow color leaves to cover up the leaves. So what exactly is this lady doing? Instead of doing this, the lady should water the plant and also put some fertilizer so that the tree can grow well, okay, so that the leaves actually can turn green instead of just painting it. I hope you all get the
Nobody's gonna know.
whatever that she wants to convey.
Nobody's gonna
here.
know. They're gonna know. How would they know?
Right, Dr. Andrew, you got anything to add?
No. Okay, so
No.
Treating symptoms many a times is going to cause more problem rather than helping. Let's give another example of treating these symptoms. Treating symptoms is like, you know, if there's a fire happening in your house, all right, and then of course the alarm will go off, right? The alarm will sound. So if you want to treat the symptoms, what you do is you're going to switch off the alarm. Instead of putting out the fire, you switch off the alarm. Okay, this is what it means by treating only the symptoms. If you put it in a humanly speaking manner, it's like, if I take, let's say I take a cup here. Okay, so I have a cup here, and let's say this cup is hot, and I decided to just, I accidentally touch it. What's going to happen is I'm going to feel pain, right? And pain is actually a symptom. Pain is a warning signal given to me, telling me something is wrong. Okay, this one is going to injure me. So if I want to treat the root cause of my problem, I need to remove my hand away from this cup, right? So, but let's say I want to treat only symptoms. I don't want to remove my hand from the cup. I tell myself, oh, it's painful. Let's take some painkillers. So, and I decided to just take painkillers. And after, let's say 30 minutes, my pain disappeared. But my hand continued to hold on to this cup. What's going to happen to me? Okay, so you and I know that my hand is going to be basically burned. Why? Because the root cause is this thing is hot. The pain that I'm experiencing is actually just a warning signal given to me. Why are we, you know, getting rid of the warning signal? Okay, this is why we shouldn't be treating these symptoms only, but we should always be looking at the root cause. But the problem is, looking at the root cause is something that is very difficult. If it's easy, then every other doctor will have been doing that, right? It's tough. So why are we doing it in Sweet Lives? The reason is because, okay, it's because about 8 years ago, okay, we can move on to the next slide. 8 years ago, I was wrongly diagnosed with a pancreatic cancer. What you can see here, there was a scan done on me in 2013, and they found a growth seated at the head of my pancreas. Okay, it was pretty big. It's actually as big as a ping pong ball. Okay, and at the point of time, they suspected that this could be cancer. And you know that this pancreatic cancer has got a very low survival rate. All right, so without finding out what exactly is this, they wanted to operate on me. So what they wanted to do was, they wanted my friend, who is a hepatobiliary surgeon, okay, offered me an operation. And the operation is this. Let's look at the next slide. The operation is this. It's called Whipper's procedure. It's a 10 hours operation. All right. It involves cutting off part of my stomach, as you can see in this particular picture, part of my stomach. All right. And also part of my intestine, the first part of my intestine basically, and part of this pancreas together with the growth. Okay. You can see this mark, this place here. They wanted to, my friend wanted to remove all this out of me. And then the rest of it, just they just joined back. So at the point of time, I asked my friend one question. I said, brother, because he's my friend. Okay, the surgeon who wanted to operate on me is my personal friend. I asked him, brother, I said, are you sure this is cancer? He couldn't answer me. So when he couldn't answer me, I told him, by hook or crook, I must find out what exactly is this. What is the root cause of this? So from Malacca, that time I was practicing in Malacca. So from Malacca General Hospital, I was transferred to Selayang General Hospital. So in Selayang, what they did was they did a scope for me. They put in a camera through my mouth. Okay, so it went all the way in. Okay, and then I put in a needle, and then I took out some sample and they checked. And you know what? They found out that it was actually TB, tuberculosis. I got a tuberculosis infection in my pancreas. It was not a tumor at all. Because of that, I escaped the operation. And you know, I'm not sure, like, ladies and gentlemen, how many of you feel that I'm actually pretty lucky to have actually escaped the operation? Yeah, if you agree with me that I'm pretty lucky, please comment that yes. Please comment that yes. All right, let me know. Okay, so because of this, I escaped the operation. I don't have to undergo chemotherapy. Okay, I only have to take antibiotics. Okay, but I took 6 months of antibiotics to actually kill this TB infection from me. And what do you think I would have learned from the lesson? Yeah, I told myself from then onwards, every time I see a patient, I must always look for the root cause. And this is why we started Sweet Lives Wellness Center, where everything we do, we will always be focusing on the root cause and root cause only. So ladies and gentlemen, if your interest is about treating the symptoms, this is not for you. But if you are really eager to know the root cause, okay, of diabetes, of hypertension, okay, in order for you to reverse them and then to regain your health, you came to the right place. All right. So with that, let us watch an introductory video of myself. Thank you.
All right.
Okay, all right, no worries. Yep. Sorry for the interruption. I think because of the lightning and the thunder, I think our internet line is facing some problem. No worries, okay? So I think we got the gist of it. And we are very honored, okay? I'm very honored that back in 2019 on World Diabetes Day, I was being interviewed by Bernama TV. So why out of thousands and thousands of doctors in Malaysia, why am I being selected? Is because in Malaysia, there are very few doctors who know how to help patients to reverse diabetes, and I happen to be one of them alongside with Dr. Jasmine. Okay, let's move on. Right, this is another screenshot. And of course, I have to thank this lady. Her name is Yimo Yong. She's actually my very first successful case. Okay, let's take a look at this case. I have been suffering, okay, Dr. Jasmine, let's highlight some of the points. I've been suffering from diabetes since year 2000. Okay, when she saw me, it was already 2018. That means 18 years of diabetes. Was on oral medication, so escalated to insulin injections. Okay, that means oral medication plus insulin injection. In spite of all these medications, look carefully, my blood sugar is still not well controlled. Don't you think this is a little sad? And I would like to know that among the crowd here that we have today, we have more than 100 of you here. How many of you are actually experiencing the same thing? Like, I want to know whether can you relate your own experience to this lady, this patient of mine, okay? That, you're taking medications, in a very disciplined manner, you're very compliant, and you painstakingly taking the insulin injection every day, okay? And you notice your blood sugar is still not well controlled. Okay, either yourself or even your family members. If you are like this, please comment why. Please comment why. Why yes, okay? At least we know that this patient of mine is not an alien now, okay? That, we are not just talking for the sake of just talking, but we are talking about something that everyone can relate to, okay? Please let us know if you are facing the same problem like what this patient of mine is facing. It means you're taking medications, escalated to insulin injections, and in spite of all this, your blood sugar is still not well controlled. Every time you go to the doctor, 90% of the time you will get scolding because your doctor will say, come on lah, so why your blood sugar is still not well controlled and things like that. And then you get a short lecture, and then after that, there you go, you are out. And then the doctor just tell you, see me after 3 months. I'm so sorry, I have to add the next medication for you. If you are like that, please comment why. Okay. Yeah, thank you so much for, wow, there's so many answers. Thank you so much, Ambika, Sherry, all right, and Pei Kang, all right, Hema, Avis, yeah, Tommy, Simon, yeah, Chen Sing, Lin, Parimala, Jaya, Juliana, Nulin. Well, I'm so sorry, your brother and your late mom. Okay, we're so sorry. Okay, so meaning this patient of mine is not an alien. She is a human. She is a human being just like any one of you, all right? So let's continue on. After seeing Dr. Andrew a year for his Reversing Diabetes program, I am no more on medications and insulin for my diabetes. Wow. Weight-wise, I've also lost 20 kg and my blood pressure has normalized. What is weight and blood pressure has got to do with this diabetes? Ladies and gentlemen, they are all interconnected. Anyone who is diabetic, very likely that you are going to be obese. Anyone who is obese, very likely this person is going to suffer from hypertension. Anyone who is hypertensive, very likely you're going to have diabetes as well. Okay, just for information, just a small little tip here. The root cause of these three conditions are exactly the same. So some of this supplement company, they're very clever. They come and tell you, they say, come, you take this supplement, you can lose weight. And then you ask them, so what about my insulin, my diabetes and my hypertension? Oh, that one, you continue to take medication. Such a lie. If you can successfully reverse your obesity, you will be able to reverse your hypertension and diabetes because they're exactly the same. Unless they're not treating the root cause, then that's a different story altogether. Okay. So here, overall, I'm very happy that my total health has improved. Thank you, Dr. Andrew. Okay, come, let's go on. Okay, so this is a picture of Yi Mo Yong. Let's see the picture of Yi Mo Yong. Dr. Jasmine, are you there? Yeah. So she lost about 20 over kg in just about a year's time. Okay, just about a year's time. Okay. So let's move on to Dr. Jasmine.
The line is not good, is it? I was moving
I
on
think
already,
so.
and then you
We
cannot
just do
see.
it what we can. Yeah. Come.
All right, never mind. So now I would like to share why I'm doing what I'm doing now, which is helping my patients to reverse diabetes. Is because of this particular gentleman, 40-so Chinese gentleman, underlying type 2 diabetes with very high dose of insulin and also medications. And in spite of those medications and also insulin injections, he got admitted because of a wound over the left shin. And why did he have a wound? It's because of diabetes also. That it is the wound cannot recover by itself, and it got worsened. That's why it requires admission for further management in the hospital. So this thing happened back in December 2016. And after this patient got admitted, I had to clean his wound every day, and almost every day I have to clean about 1 hour. You imagine those wounds that you need to clean for 1 hour. That's why I had a very long hours with him, that I got to interact with him and talk to him, and I got to know this patient. What happened was, after that, about 1 week after I cleaned his wound over the left shin, the orthopedic surgeon told him that, oh no, I can't save your wound anymore. In fact, it has gone into the bone. That's why I need to do an amputation very quickly. So right after that knee amputation, the below knee amputation, I continued to become the doctor who took care of his wound. But unfortunately, after that, he needed another operation, which is a below hip amputation. Okay, and then very sadly, very sadly, he passed away within a month after admission because the below hip amputation wound got so bad that he actually got into sepsis. Sepsis is something like an infection whereby he will get into a fever, and then the bacteria has gone into his vital organs, and there he passed away within a month just because of a wound. Okay, very sad because he left his wife and also his 2 children, 1 son, 1 daughter, 10 years old and 6 years old. Okay, this is why I'm helping my patients to reverse diabetes, because I know the complications of diabetes cannot be reversed. Once you lose a leg, means you cannot save the leg anymore. Okay, we can withhold the thing by reversing the condition, okay, by improving the HbA1c. And this patient, if they know us earlier, he might not even get admitted because of the wound. Okay, he get to reverse his diabetes, and then he get to enjoy his life together with the family. Okay, you get what I mean? Okay, I hope you get what I mean. Right, let's watch an introductory video.
She's just a girl and she's on fire, feeling with catastrophe, but she knows she can fly away. Oh, she got 4 feet on the ground and she's burning it down. Oh, she got her head in the clouds and she's not backing down. This girl is on fire. This girl is on fire. She's walking on fire. This girl is on fire.
Right. So this is my first successful case, and I'm very thankful for this particular lady who trusts us enough, okay, that I was able to help her also. So over here is written that she is 66 years old, right? She's 66 years old, and then she was on high dose of insulin, 52 units of insulin every day, and also medications. And in spite of that, her sugar level go higher and higher until she feels dizzy. I don't know. I'm not sure whether some of you may feel this also because of the sugar. Okay, some of you may think, well, sometimes I inject 2 liter insulin, then my sugar shoot up. If I inject too much, I'll wake up at 2 a.m. because of low blood sugar. Yeah, that's why it's quite hard to take control of that. Yeah. So after that, he joined our reversing diabetes program, and I have to stop her insulin because she actually went very low blood sugar for about 2 to 3 weeks, 2 to 3 times in a week. That's why I have to stop her insulin after 2 weeks. Her pressure also has gone down to normal. Well, before this, she was in the borderline case, although she's not on any antihypertensive. And more importantly, he has lost 3 kg because previously she looked like a 4 months pregnant woman, and she got to change her pants size, downsize her pants, of course. And finally, she's so happy because she finally get rid all of the jabs that causes blue, black, and itchiness. Some of you may be able to relate with this. Anyone of you able to relate? You may say yes, because of injections causing blue, black, and also itchiness over the belly, over you see, she wrote here stomach lah, and also thigh. Some of my patients, they even share with me their difficulty while injecting. They even see blood sometimes. That's why they need to think about it so many times. And some of you may be able to relate, so you may say yes under your comments. Either you or your family members may be able to relate to this, that you experience blue, black, and also itchiness, right? So a bit of disclaimer before I really jump into this presentation. The views and opinions that I'm going to present are based on our own research and also clinical experience. Please consult your own doctor before making any changes to medications or lifestyle. Okay, bear in mind, because it's very dangerous if you make any changes to your own lifestyle or even your medications. Don't, because we have helped our patients to stop medications. After this, please don't do it by yourself, and then you just stop all your medications. It's extremely dangerous. We'll show you why.
Right, this is one of my patient. You can see that on the first day said that she saw me, all right, on the 8th of August 2020, her blood sugar, the fasting blood sugar was actually 7.9, which is high, of course, all right. And within a week, right, if you can see on day 8, on the 15th of August, that means in about 7 days, the sugar actually went down to 3.6. And if you look below, on the 18th of August, it was actually at 3.1. Anything less than 4.0 is considered as hypoglycemia, which is very dangerous. You can anytime go into coma, okay, and of course you will be fainted and things like that, okay. So it's a life-threatening condition. And actually, this patient for this result is not even the lowest. Let's check out the next slide. You'll notice that it's actually even lower at 2.9. This patient of mine, okay, she's actually taking insulin. You can see that it was written in Mandarin, but you can read the word insulin. And she wrote that 26 units, okay? It's actually twice a day. So because she was under our care, I was able to actually guide her and I actually told her to stop her medication, as you can see. But ladies and gentlemen, no two patients are the same. Please don't think that, wow, next time, if my sugar drop, okay, I can just stop my metformin. No, it doesn't work that way. Because every patient is different, okay? The number of years of diabetes is different. Reversing diabetes is a simple thing to do, but it's not easy, okay? So please don't do it yourself, okay? This is a very serious warning that we'd like to give. And of course, ladies and gentlemen, many of you might be thinking, these two doctors are going to just share some successful cases, right? No, not exactly. We are now going to share with you even unsuccessful cases. Why? Because we want to be very transparent with you. We want to be very open to you. Not all patients who are under our care will have successfully reversed their condition. Our success rate is 82.3%. So this is one of the failure. Okay, so this patient of mine, she was on 21 units of mixed start. If you can see the first time when she saw me, yeah. So I find it very weird because she took this only in the morning. So I asked her, I said, hey, how come your insulin is in the morning only one? What about the night dose? And she told me, she said, no lah. My doctor asked me to inject twice, but you know, I can't take it now at night. So I decided to go for once. I told her, I said, no, you're playing doctor. And this is very dangerous. Never ever play doctor. I told her you don't adjust the medication or insulin by yourself. Okay, you don't ever drop off or even add on medications or think that these medications are expensive. Let me go and buy something cheaper than pharmacies and just trip. This is complete stupidity. Why do I say it's complete stupidity? Let's check out what happened to this patient. So actually on the 5th session when she saw me, she told me that she was actually admitted to SGMC, in one of the private hospital in Klang Valley, and she was in fact in ICU and HDU a day each, diagnosed as diabetic ketoacidosis. This is one condition that can put you into coma. Her blood glucose was 20++. Okay, now you know why I say it's complete stupidity. You're playing around with your own life. If you're just playing with money, okay, you go and do some investment and you lost some money, that one is probably still fine. But it's no good if you're playing with your own life or even your family member's life. All right. So, and let's check out this patient. Her HbA1c on the 2nd of June, right, okay, was 10.4%. Okay, if you can see here, it's 10.4%. But after about 4-5 months, it only went down to 9.9. Okay, to many of you, you probably think that, wow, this is good, improvement. Yeah, to many of you, probably you think it that way. But for us, we are very strict. This is failure. True enough, when I asked her, okay, so now you are discharged from the hospital, okay, are you complying to medications now? And you know what she told me? Okay, you notice what is written there? She is not compliant. And I told her, I say, since you have a life-threatening condition and you decided still not to be compliant, let's stop consultation. I told her, I'm so sorry. It's a failure. I won't be able to help you to reverse your diabetes anymore. Please continue on with your lifelong medications and insulin. Yeah. So we do have unsuccessful cases. Okay. The first thing that if you do want to fall into this category, the first thing you need to do is don't play doctor, unless you are a doctor yourself. That's a different story. Okay. Let's move on.
So in this presentation, when we talk about this word diabetes, it will be referred to as type 2 diabetes, right? We have type 1, type 2, type 3 diabetes. Okay, type 3 diabetes is Alzheimer's disease. Okay, today we are not going to talk about it. Alzheimer's dementia is also a type of diabetes. Maybe we just want to share. A person with diabetes, they are very likely to get Alzheimer's disease. And what is the percentage, Dr. Andrew? About 50 to 80%. Right. So a person with diabetes, they are 50 to 80% more likely to develop Alzheimer's disease.
Yeah.
And then,
so do not be surprised if you notice that if your family members having type 2 diabetes and then, they started having memory problem and going into Alzheimer's and all this, this is nothing to be surprised of, because I'm sorry to say, actually the root cause is also almost the same. All right. So I don't know if any of you are also experiencing this. You notice that your family member, somebody who is, having this Alzheimer's, they are type 2 diabetes, but they're also having Alzheimer's. Maybe you can put a Y there. You can put a Y there and, maybe let us know that, we are not just talking for the fun of it, okay? But we are talking in reality. And why are we talking about type 2 diabetes today is because 90 to 95% of the diabetes in the society, okay, in the whole community are type 2, right? That's why we are not going to touch much on type 1 and also type 3, okay? I think that's fun. All right, we have some struggles here, by the way. Okay, Dr. Jasmine and myself, we have a combined 27 years of clinical experience in terms of course, reversing diabetes. But the problem is we have to summarize this 27 years of experience into just a 2-hour talk, okay, up to 10 p.m. So therefore, we want to apologize first if we are not able to pick up your questions because time is very precious. And we want to do our level best to share our knowledge with you, okay? Our not just research, but also clinical experience with you, okay? So this is going to be one of our struggle, okay? And next one, of course, today, they are actually way more than 3 secrets. You will notice that there are way more than 3 secrets, okay? But today, we're going to share with you the first top 3 secrets of diabetes first, okay? And next up, okay, just do bear in mind that information alone doesn't create change, okay? What do I mean by that? if tonight you already know that diabetes is reversible, okay, you know about the symptoms, or you know about the problems with the medications, but if you don't take action to do anything about it, that means you just like, oh, okay, thank you, Dr. Andrew and Dr. Jasmine for telling us that. Okay, we will go back to our life and we will just go and take medications and whatever. Nothing is going to change. Okay, so information alone doesn't create change. How many of you agree with us on this part alone? If you agree that information alone doesn't create change, so okay, please comment there why. Please comment why. Okay, and if information alone doesn't create change, what create change? Let's check out the next point. Please take action to implement. Okay, if you don't take action to implement, all right, no one is going to be able to help you. Okay, you need to take action to implement. Information alone will not help you. All right. Okay, let's move on. Okay, and of course, sharing is caring. I think somebody gave us a short little praise, saying that what is that? Somebody share with this very good talking. Right, ladies and gentlemen. Just for information, I'm not sure. We have been talking for the past half an hour. How many of you realize that the language that we use are quite layman? And I'm not sure how many of you actually would agree with us that many times when you go and see a doctor, right, the doctor will speak to you, right? Every 10 sentences the doctor tell you, you notice that you only understand probably 8 sentences. Hey, no, not 8, sorry. You understand probably only 20%, 2 sentences. And the rest of it were like, okay, okay, all right. Thank you, doctor. I will go back and take my medications. How many of you can relate to this? You notice that the doctors are just talking like, it's as though doctors are talking to themselves. They are sharing with you all the medical terms that you don't understand.
Please don't blame them.
Yeah,
because we are being taught this way.
Yeah, correct. Because you see, talking is a skill. Okay, presentation is a form of skill. And Dr. Jasmine and myself, we have invested not tens of thousands, we have invested hundreds of thousands in order to speak in a very simplified manner. We have the talent of simplifying medical knowledge so that you understand what is going on. And today is not how well we can speak. What is the point if we can speak so well? There are only about 100 of you in this room, but there are so many people in Malaysia, so many people worldwide. So what matters is if you share. All right, sharing is caring. Okay, it's not how well we can share, but how well you can share. And at least even if you cannot share, all right, at least you can share about our presence to your family and friends. At least they know, diabetes is reversible. Okay, let's go on. Okay, so let's move on. Okay,
talking about change, the most constant thing in this world is actually change. The world is changing, and it very much depends on you whether you want to pick up the change or not.
Yeah. So if you refuse to change, nothing is going to change. All right. And if you refuse to change in terms of the way consultation is done, okay, the way education is done, no one can help you actually. All right. So yeah, let's change. Okay, let's go on. Okay.
Right. The next question: are we diagnosing diabetes on time? If you think that we are diagnosing diabetes on time, you may type number 3, yes. Or if you think no, we are not diagnosing diabetes on time, then you may type no.
Yes. Just put a 4 or put a no. Okay. Yep. So let's share. This is going to be the first secret, by the way. This is going to be the first secret. Are we diagnosing diabetes on time? Okay. Let's move on. Okay.
Right. So in order to understand,
we'll do a quick one because I believe many
question,
are diabetic.
Okay, I will do a very quick one. Okay, diabetes, knowing the symptom. Of course, these 10 symptoms are not all the symptoms. Okay, this is just the I think are the most.
They are not exclusive.
The more common one lah. The more common one. Of course, there are way more than these symptoms. All right. So patients who are diabetic, they tend to feel more tired. Okay, the reason is because the blood sugar always stay in the blood vessel. And unable to go into the cells. That's why they will be always feeling very tired, always want to sleep, always feeling hungry, always thirsty, want to drink water. Moving on, frequent urination. And they even have this problem of having night urination, whereby they wake up more than 2 times in a night just to urinate, and this will in turn affect their sleep. And the whole day will be gone because the productivity will reduce because of lack of sleep. Moving on, sudden weight loss is also one of the symptoms of diabetes. Okay? Sudden weight loss is not only one of the symptoms for cancer, okay, but a person who just diagnosed with diabetes will get a very sudden weight loss, like maybe 10 kilos in about 2 months. Then they will realize, oh, I'm a diabetic. Wounds that won't heal. This is quite common in the clinical setting, whereby the patient will come with a wound that hasn't healed yet for about a month already, although it's just a very small cat scratch. Okay, it might just be a very small cat scratch or a mosquito bite scratch, but it didn't heal for about a month. So it is during that time that they will find out that the doctor will they will go to the doctor, and then the doctor will ask, do you have diabetes? He say, no, I never have diabetes. Okay, but in fact, after checking the blood sugar will be sky high, will be very high. So this is the problem of diabetic patients, because the reason is because of high, very good sugar inside the bloodstream, whereby the bacteria will tend to stick to the wound, so it will delay the healing. That is one reason. Number two is the poor blood circulation of diabetic patient, where sometimes they will even get into this numbness, whereby because of this numbness, they won't realize that they have a wound under their feet. So because of that, they won't take care of that wound and delay the healing. Moving on, sexual problems to guys, whereby the third leg unable to stand up, erectile dysfunction, in other words. This one, man will be very embarrassed to tell the doctors. Usually will be the lady, the other half, the wife, will be complaining to the doctor. Oh no, my husband has this erectile dysfunction and we are unable to enjoy our sex life. So this is the problem of guys. But God is very fair. So if male has problem, female will also have problem, which is this vagina infection. And other problems like urinary tract infection are also very common in diabetic patients. The higher the sugar level, they will tend to get more of this urinary tract infection. In fact, every year they might get these symptoms of fever, and they don't even have to get this the burning sensation when they are urinating. Okay, so this is one of the common symptoms. Blurry vision, okay, whereby we know that diabetic patients, the higher the sugar, it will affect your blood vessels in the eyes. Okay, and then that's why we always advise our diabetic patients to go for the eye checkup regularly. Okay? So among our beloved audience, do you know which are the symptoms, which is the symptom that is the commonest symptoms of diabetes? The commonest symptoms of diabetes. If you think it is tired, then you may write tired. If you think it is sudden weight loss, then you may write sudden weight loss. If you think it is sexual problems, then you may write erectile dysfunction or wound that won't heal. Now, which one is the commonest symptoms? Commonest symptoms of diabetes. Or you think it's always hungry, or it may be your own personal experience that you are facing this problem. So which one do you think is the commonest symptoms of diabetes? Okay. So waiting for the answers, I may
Back to the question just now. Actually, most people say that we are not diagnosing diabetes on time. Oh, we seem to have a very clever crop, right? That's very good. Yeah. So there are a lot of answers coming in now. Always tired, okay. Urination, wound not healing, tired. Oh, tired, we have two answers now. Always hungry, by Norlene. Yep, okay. Thank you so much for sharing. Tired, Jenny said tired, okay. Thirsty, hungry, wound that won't heal. Ooh, there seems to be an accurate answer that pop up. I think let us review the answer now, okay? Because time is running out. Let's go on.
So the commonest symptoms of diabetes is no symptoms. Okay? That's why a lot of people don't know, right? So there are two phases of type 2 diabetes, okay, whereby you can see here, this is the blood glucose level, whereby lower than 6 will be considered as normal over here, right? So, and then years to diagnosis or end of follow-up. Over here, this patient has diagnosed, is diagnosed with diabetes at this phase, whereby for the past 12 years over here, from negative 12 to negative 2, about 10 years, this patient has been slowly having increasing blood glucose level. And yet,
in a very gradual manner.
Yes, in a very gradual manner. And yet, the doctor will tell, oh, your glucose level is normal, no problem. But yet, suddenly he was being diagnosed with diabetes. And this one, of course, is the one without diabetes. And let's look at this study done by this Kraft. And this Kraft pattern is not a very small study. It is done in more than 14,000 people. And how he did this study was by taking the insulin level of these people. Right, we can see during fasting, the insulin level is, of course, low. Okay, but about half an hour later, 1 hour later, 2 hours later, it will slowly increase. And the person with lower insulin level, which is this blue line, of course, is they are not having diabetes. And how about this red color and also the yellow and orange lines? They are actually diabetic, but yet this yellow and orange line, they were told that no, you are not having diabetes because their blood glucose level was normal. Okay, so this Kraft has tested 14,000 of people, and 75% of the people has normal glucose result, which is they failed the Kraft test. Why they failed? Because they were diabetic. Moving on, so now we are revealing secret number 1. We are diagnosing diabetes 10 years too late. So why is diabetes so scary? The reason of when a person is diagnosed with diabetes, it feels like the end of the world. Okay, but it is not actually a thing that you get diabetes today, you will die tomorrow. It's not like that. But in fact, you will live a quite good years before you actually pass away. But why is it so scary when they say that when a doctor diagnoses a person with diabetes? Because they usually will tell you, once you get diabetes, you will have to take medication for the rest of your life. And most of the time, if you're 5 or 10 years of diabetic already, you will likely to be prescribed with insulin. So why is diabetes so scary? It is because of this problem. Our blood vessels in the body looks like a tree trunk. So this is the tree. This is the picture of the tree, and this is our blood vessels in our body. So the middle one will be the thickest, and then when it goes to the peripheries, where it goes to the side, our hands and our feet, it will become thinner and smaller. So why does this narrowing happen? It is because when a person has high blood sugar inside the blood vessels, okay, the blood keep flowing with high blood sugar, it will cause the blood vessels to have inflammation over the walls of the blood vessels. So what happens when you have inflammation? Inflammation is just like our pimple. Okay, if one person has pimple, it will be yellowish. Okay, and then we will tend to go and pop it out. Okay? This thing will happen in the blood vessels, whereby in a very long run, these blood vessels will get smaller and smaller, and after that, it will get blocked. So what happens? Of course, blood vessels is all over our body. What happens if the blood vessels in the brain get blocked? The person will get stroke. It's just like this man. Stroke. And then, okay, in fact, this man is quite lucky because he's still able to walk. But a lot of people, after facing stroke, he might not be able to stand up anymore. And I have patients sharing with me, his own father, unable to stand up and walk. For 10 years, he was bedridden until he passed away. For 10 years, he was unable to bathe himself. He needed pampers. He needed someone to feed him. He wasn't able to walk around. So that 10 years was really, really a suffering for his whole family, okay? Because he basically sees his dad suffer. And what happened if you lie down on the bed too long? Bed sore will happen. This just like this pressure sore. So this is not even a very bad sore to me. Yeah, I've seen worse wounds whereby I was able to see the backbone of the patient because I need to clean a lot of this kind of wound, just like how I have cleaned it, how I have cleaned the patient's left shin wound, okay, in the beginning of my presentation just now. So a lot of times, this wound is not only one, there are multiple wounds at a time. And we actually need to spend a lot of time in cleaning those wounds. And it's very sad because once a person gets stroke and he's bedridden, it's the quality of life just go down straight away. Okay. And this is a patient from Singapore.
Yep. This is a patient of mine from Singapore. She's 70 years old. And you can see that, you see, why do we say that we diagnose diabetes 10 years too late? You can see in this particular patient, she experienced a mild stroke back in 2000, the year 2000, with right hemiparesis, means right body-sided weakness. And at the same time, she was being told by the doctor, oh, Asoa, you actually have a diabetes and hypertension. Okay, meaning to say the complication happens, then only they realize that, whoa, okay, I'm actually diabetic and hypertensive. Yeah, so which is of course very sad. She also suffered from ACS here, acute coronary syndrome, meaning a heart attack. Okay, before she actually started seeing us. Yeah, so of course after seeing so many of these complications, the doctor decided to engage our service. Okay, so the mother is now under our care. Okay, she's in Singapore. She's under our care to help her to reverse her condition. You can see she's taking so many medications here. 10 tablets per day. All right. Okay, let's move on. Okay, we also have a patient from UK. Okay, this is my patient from UK, and she is recently diagnosed, actually March 2020. But when she was diagnosed, it was actually pretty bad. That's why she was actually on mixed start 20 units twice a day. That means straight away she was started on insulin, and because of course she just felt so bad with this insulin and all this. She decided to start the program, and within 2 months, I managed to switch off everything. Okay, that means she's now no more on medications, now no more on insulin. Right? Let's move on.
So what happened if the blood vessels inside the heart get blocked? This person will have heart attack, and we know that the incidence of heart attack is increasing in rate, and it's getting younger and younger. Just recently, of course, before the lockdown, I gone for hiking. Okay? And then there was one incident whereby it saddens me a lot. And that day was a very, very sad day to me, because when I descend from the mountain, there was one guy who lay on the floor. And then the paramedics was already there, taken the defibrillator to actually pump the heart. And when I reached that incident, the place of incident, I actually introduced myself as a doctor, and then anything I could help, but they say I have already pronounced it. Okay, so I actually didn't interrupt a lot because of the COVID also. And then I asked further questions. The patient is actually, that particular man actually is just 50 years old, Chinese, a very big size, obese man, and then has underlying diabetes and also hypertension. And at that point of time, of course, we know that this patient is a very sad thing for the wife. Okay, the wife was at the side, crying, and then I still can remember his face until now. Okay, because the patient was lying down there. His lips already turned blue, and then the eyes roll up. Okay, it's not closed. And don't think that if you are very active, you always go for hiking, you always, do a lot of exercise, you won't get these complications. Okay, a lot of people just die on the spot, like playing badminton. We know, okay, some of them just die in the court itself, right? So I think Dr. Andrew has also this experience, right? Dr. Andrew, hello.
Yes.
Hello, Dr. Andrew, are you around?
Yes, I'm here. All right.
Do you guys have this kind of experience that you want to share?
No, I think because time is running out, I think we have to move on.
Right. So
yeah.
we just move on from here. So this patient is Dr. Andrew's patient.
Yeah, this is real experience. This is our patient, Malay gentleman. So he did a stenting, okay, on 28th of April. That was when MCO already started. And you notice this is another similar case, diabetes diagnosed too late. So by the time he found out that he was diabetic, okay, he already had a heart attack, okay, and thank God, of course, he survived the heart attack. All right, so let's move on.
So we know that the diabetic patients, their kidney will also get affected. So this is just a picture of a patient undergoing dialysis, one in and one out, right? So Dr. Andrew has the license to open a dialysis center, so I actually want to pass the time to him to explain about this dialysis.
Yep. Right, it's true that I'm one of the very few doctors in Malaysia who owns a license to start a dialysis center. In fact, I'm taking care of about 30 dialysis patients at this moment. I have to see them once a month in the dialysis center. And to be very frank, it's a very depressing scene every time I see them, because dialysis is actually a full-time job. Why is it a full-time job? It's because you have to actually get yourself dialyzed 3 times a week. Okay, it's usually 135 or 246, and it's a very painful experience, not just for the patient but also for the caretaker. And of course, this is also a very expensive treatment. It's also a very expensive treatment. I'm not sure whether among the crowd, how many of you are aware how much does it cost to actually undergo a dialysis, okay, each round. Okay, can someone just put in a number, okay, if you know the answer, okay, please, or you probably just want to guess how much does it cost in Malaysia for you to have a dialysis done in, okay? And why do I say it's very depressing is because, you see, every 3 diabetic patients, every 3 kidney failure patients, okay, every 3, 2 are actually either diabetic or a hypertensive. Okay, which is of course very high. It's about, we are talking about even 60-70%. In fact, the last round when we did a talk, we had a dialysis nurse who are actually among us, and she told us that in her center it is 80%. That means 80% of the kidney failure patients are due to diabetes and hypertension. And so why do I say it's very depressing is because last time when I first took my license for this, to me I was like, it's okay, kidney failure anyway, you know, it's just a part and parcel of diabetes and things like that. But nowadays, it feels very depressed because I know very well that kidney failure, right, can be prevented if you reverse your diabetes early. Okay, if you reverse your diabetes fast, reverse your diabetes early, you can prevent kidney failure. If you are taking medications or insulin, you can forget about preventing kidney failure. You are just a time bomb waiting for kidney failure to happen. Okay, so wow, we have so many answers here. All right, so we have some people say 280,
500 to 1.5K, I forgot.
yeah, so 500 to 1.5K, 250 to 450. There's so many answers. Okay, all right, so to round up, actually the answers is about $300 each time. Okay, there's a range 200 plus to up to 300. So you think about it, one month, right, you need to go for 13 times. You multiply by 300 is about 3,009. Let's round up to 4,000. It's 4,000 ringgit per month. And if it's for a year, you multiply by 12, is 48,000. It's about 50,000 ringgit per year. If you live on, the patients whom I've seen that really live on, right, it's up to like 27 years. Let's say we don't want to talk 27 years, just say it's 20 years. 20 years, right? 20 years multiplied by 50,000, we are talking about 1 million ringgit here. Question, how many of us actually have 1 million ringgit in the first place? Okay, and even if we have it, do you want to spend it on this? Do you want to spend on dialysis? Do you want to undergo this kind of pain? All right, it's a full-time job. Yeah, all right, someone say in Mandarin, fu gui bing. Okay, it's a disease of the rich. It's so true. It's so true. Yeah, and just bear in mind, 4,000 ringgit doesn't even include the medications and some of the injections that the kidney failure patients require. Okay, just for information. Okay, let's move on. Okay, we have to rush a bit. Right. So this is the needle. It has to be big, yeah, obviously, because the needle has to be drained. The blood has to be drained out to the dialysis machine, and then of course drain it back. Okay, okay, right. Yeah, very good. Someone said no, she doesn't want to. Yeah, they want to spend the money on holiday. Yeah, that's exactly right. You came to the right place because this is where we will help you to prevent kidney failure. All right, so I'll show you another patient of mine. Okay, so this is actually another failure. All right, this patient of mine, she's called a supplement queen. She's on 24 supplements when she saw me, okay, including protein shakes. So when she started the program, I told her, okay, you want to be good, you have to stop all your supplements. Your supplements have caused your problem to be where you are now, okay, so please stop. Okay, so on the 22nd of July, you can see that her HbA1c is 8.9%. which is still pretty high actually, yeah. And after started on the program, you realize in about 6 months' time, her HbA1c not only didn't drop, it actually went up. I told you, okay, we mentioned that we want to be very truthful to you. We are going to share unsuccessful cases with you. This is just another unsuccessful case. Do you know why? I told her to switch off everything, but she refused to stop her protein shake. She was hiding away the protein shake from me. She was not telling me. Okay. And I'm not sure, ladies and gentlemen, how many of you here think that, you know, protein shake is good actually, you know? And how many of you are actually taking protein shake now, protein bars, and you've been told by all these salesmen, these MLM people that, you know, carbohydrate is bad. A lot of people now know carbohydrate is bad. And fat is also bad. And fat is bad. Let's go for protein. Protein is good. Protein is good. If you are taking this protein now, please say yes. Please put a Y there. Let us know that, you know, this patient of mine is not an alien. She's just another human beings, okay, being conned into taking all these protein shakes. If you are just one of them, please put a Y there, so at least we know you're taking this protein. Okay, so these people tell you, oh, you must take protein shake in the morning, in the afternoon, in the for dinner and things like that, so that you don't have to take other things. It's healthy. Really? Really? Come on. Protein is good. Excess protein is not. Excess protein in our body is converted into sugar, into carbohydrates. So, if you're still wondering how come you've been taking this protein shake for don't know how many donkey years, and you realize that your diabetes is not recovering, it's not recovering, so it's not being reversed, now you probably know why. You see, we're sharing another secret with you. Do you think that these people who sell you these supplements, or do you think even the doctors will tell you that protein is being converted into sugar in your body? The excess protein, I mean? No, they will not. We have just shared the first secret to you, whereby we diagnosed diabetes 10 years too late. You think the doctor will tell you that, oh, I'm so sorry, man, we are diagnosing diabetes 10 years too late? No, they will never tell you. Because it's like slapping themselves. Doctor, you diagnosed diabetes and you know, and yet you are still doing it. Of course, they won't tell you. These are the secrets that the doctors won't tell you. This is one extra secret. Excessive proteins are bad for you. Don't think that by taking all these protein shakes and protein bars or whatever, you can reverse your condition. You can't. All right. So stop wasting all these thousands and thousands of all these ringgit on all these supplements, which is completely useless. None of our patients are on any supplements in order to reverse their diabetes anyway. So you don't need any supplements for that matter. Okay. Let's move on. All right, we even have patients who are on kidney transplant, you know, and of course, so we are also helping patients who have had kidney transplant to reverse their condition. Okay, I think we have to, okay. Our youngest patient is 27 years old, by the way. So if you're thinking that, no lah, I'm still very young lah, I'm in my 20s. No, nowadays, this diabetes hits very young patients. Okay, let's move on.
This patient is 28 years old and she was diagnosed with diabetes 3 years ago. HbA1c was 9.2. That means 25 years old, she started having diabetes already and she's on 3 medications, right? So she was also overweight that time, right? So we want to help her lah. And then moving on, the eldest patient is 83 years old.
Our eldest patient is 83. So if you think that you are in your 70s or in your 80s that you can't reverse, no, not really. The question is, do you want to reverse or not? Do you want to regain your health or not? If you don't want, no one can help you. Okay. And of course, if you're not taking action, as we mentioned, information alone won't create change. Okay. So our eldest patient is 83. It can be done. The next complications that we're talking about is a diabetic wound. All right. So we know that many of these diabetic patients, after about 5 years, they start feeling the numbness over their feet. Okay. Especially at the toe area. And then because of the numbness, if they injure themselves, they won't know. And because of the lack of blood circulation, the wound won't recover. Okay, in Sweet Lives, we actually use a device called Sweethearts to improve the blood circulation in order to save the toe. Okay, and when we save the toe, we save the entire leg. We save the entire leg, we save the person's life. Because there are many people, when they lose their leg, they lose their life. Just like what Dr. Jasmine shared just now, what she's doing is because she saw how her patient lost his life just in a month's time. From the time he was admitted until he actually passed away was less than a month. Okay, leaving back the 2 very young children. Okay, let's move on. Yeah, this is another case of us. You can see that obviously this is gangrenous, the second toe, and in just about 5 months' time, we managed to reverse the condition and we managed to save his toe. Okay, so for those of you who are having this problem, okay, with this wound that you notice is not recovering, okay, you can PM us. Okay, you can PM our customer service, and okay, our customer service will brief you on this. Okay, let's move on.
So this is the leg with amputation, like what my patient has done, which is the below knee amputation and also the above hip amputation. Okay, below hip amputation, right? So amputation is a emergency surgery because once a person get the wound and then once the bacteria gets into the bone, it's called this condition called the chronic osteomyelitis, and it is a very uh, urgent surgery because the bone actually has got very good blood circulation, and if we don't amputate the leg straight away, it can go into the vital organs. Okay, that's why my patient passed away so quickly in 1 month's time after admission.
Yeah. Okay, all right. So this is how we use sweethearts to actually save this person's toe. Okay, all right. Let's move on. Let's move on. I think time
So
is
this
running
patient
out.
has numbness and also feeling thirsty and no longer numb and no longer thirsty. Okay, this is my patient. Okay, so let's take a look of the complications of diabetes and how much does it cost actually if you have these complications. So this is just the price of the event year. So myocardial infarction is a person of having heart attack. Heart attack, you need to spend so much, 20,000 ringgit. And then stroke. Stroke is about, it is 8,700. Heart failure, 5,000. Ischemic heart disease, ischemic heart disease is whereby the tissue inside the heart has already died off already. So it's about 4,000. Amputation is not free. Cutting your leg away is not free. It's about 6,000 ringgit. Blindness, it's about 2,004. And then renal failure, just now Dr. Andrew has shared renal failure about 42, and then not inclusive of those injections some more, and also blood tests. Diabetic foot ulcer, this 316 is only for one dressing. Yeah, and we have so many kinds of subsequent dressings, right? So the total cost over here during the event year, for the complications itself, total cost is 88,000. The question is 88,001 ringgit. You want to use it to treat complications, or you want to treat, or you will be more willing to reverse your diabetes?
Ladies and gentlemen, as a diabetic, you have to understand that you like it or not, this amount of money is something that you probably have to spend. The question is, which one do you rather spend on? Do you rather spend on complications, or do you rather spend to reverse your diabetes? If you are one of those, who want to reverse your condition, probably you can just put there, just put there reverse. Okay, let us know that you are actually serious about it, that you know that now, after understanding about all these complications, you really want to try your level best to prevent, and therefore you rather spend the money to reverse rather than to treat complications. Okay, let's move on while we wait for the answer. Come.
Right. So can medications and insulin prevent the complications of diabetes? For those of you who are taking medications or insulin injections, what do you think about this statement? Can these medications that you are taking, you swallow it every day, and also insulin, prevent the complications that I've just mentioned just now? If you think that 5 is yes and 6 is, if you think yes, then you can type 5. If you think no, then you type 6.
Yep.
Okay. So
since we know that complications are so scary, right? So the next question comes is this lah. Do you think the medications that was prescribed to you, or insulin, or even the supplements, those useless supplements that was prescribed to you, right, can actually prevent the complications of diabetes? Because I'm pretty sure when they are being prescribed to you, right, I'm very sure that your doctors were told you, hey, please, you have to be disciplined taking medication and insulin so they can prevent the complications. Is that the truth, or is that a lie? Okay, so do you think it can prevent? If you think it's yes, please comment 5. If no, please comment no. Okay, while waiting for the answers, let's proceed. Okay, because we don't have time to, let's go on. We're going to look into one clinical study. This is a very huge clinical study, done on 10,000 patients, diabetic patients. It was done in Canada plus US, these two countries, And do take note, this study was published in year 2008, if you look back. It was published in 2008. That means this clinical study was done in the year of 2005. So it took about 3 years to complete, and then after that, of course, to publish the paper. Let's check out what happened. They have divided these 10,000 patients into 2 groups. The first group are those who receive standard therapy. Standard therapy means standard dosage of medication and insulin. Therefore, you notice the blood sugar is still pretty high. The HbA1c is actually up here about 7.5, still high. Then the next group, the next 5,000, you know what they did? they intentionally increase the dosage of medications and insulin. So they bring it up so that the blood sugar drop. And then therefore you see the HbA1c for these patients, right? They're actually lower. You see the lighter dots, right? They're actually lower. They are called the intensive therapy group. 2 groups, right? So what they realize in this clinical study, what they realize, let's check out this one. Okay, on this particular graph, is death from any cause. The standard therapy, you notice, is actually lower. The darker dots correlate with the darker line. It's actually lower. But those who receive intensive therapy, right? Wow, it's actually higher. Isn't it a bit surprising? Yeah, meaning to say, anyone who's on intensive therapy, right, treatment, right, they're actually more likely to die. And this is a secret we want to reveal to every one of you now, today. Okay, let's check out. Which is, intensive treatment causes more death by a whopping 22%. That means to say, you are taking more medications, you're taking more insulin, you try to bring down your insulin, your blood sugar level, right? Wow, let's say your blood sugar level is beautiful, okay? Your HbA1c is 6.0, or like, wow, your doctor say, so good, so good. Do you think you are in safe hands? Yeah, you are not. Do you know that this clinical study was ended 18 months before the check time? Because they realized that it was unethical for them to continue this test. Why? Because too many people died. Because when they increased the dosage of medication insulin, they noticed more people died. So they got no choice because they found that it was unethical. They have to stop the clinical study. And they published this paper back in 2008. Question now. Why is the treatment causing more death? Yeah. Okay. Because of time factor, I don't know whether I want to share, why is the medications that you're taking is causing more death. If you really want to know at this point of time, okay, please put a Y. Okay, please put a Y. If you can gather 20 Ys, okay, 20 Y means yes, you want to know why is the medication and insulin causing more death, okay, rather than helping you. Please put a Y. Once we gather 20 Ys, then we will explain this. But ladies and gentlemen, the secret that we just revealed to you just now, okay, so turn back to the secret just now. Think about it. Do you even think that your doctor who prescribed medication and insulin to you will actually tell you this? Isn't this one of the secrets that your doctors will not share with you? You just think about it. It's going to be so stupid if the doctor share this with you. It's like, you know what? Oh, Mr. So-and-so, let's say, Mr. Simon, you know what? If you take this medication, you're going to die faster, It's just too funny, right? It's just contradicting itself, right? Your doctors will never share this with you. But this is a clinical study that was already done in 2005, published in 2008. We are talking about 13 years ago. It was 13 years ago that we already found out if you are on medications, it's not going to help you. Wow, we have so many why. There's so many whys, right? Yeah. So let me share now. You want to know why medications causes more death? Let's look at this. Okay, we all know sugar is bad for us. Sugar is like rubbish. Okay, so ladies and gentlemen, if you have rubbish in your kitchen, what are you going to do? Are you going to throw it outside of your house, or you're going to throw it? Let's say you have an empty bedroom in your house, and you decided, hey, I got empty bedroom now, huge space, got some wardrobe and things like that. I can throw the rubbish into that bedroom instead of throwing outside of my house. What's going to happen?
Oh.
So you and I know this is a very foolish thing to do. It's a very stupid thing to be done. Nobody throws rubbish into your own bedroom, right? You will always throw it outside, right? So now coming back to taking medications and insulin. So initially, this sugar is inside your blood vessel. So you started taking insulin, you started taking these medications or whatsoever, these oral hypoglycemic agents or whatever. Okay, and these medications and insulin, where are they pushing your sugar to? Are they pushing the sugar out of your body, or they are still inside your body? I think you guessed it right. It's inside your body. The sugar has been transferred from your blood vessel, pushed into your liver. That's why you have fatty liver. Pushed into your pancreas. That's why your pancreas, is being congested. It's pushed into your brain. It's pushed into your heart. It's pushed into your kidney and everywhere. Now you know why. Okay, so sooner or later, this sugar is going to, of course, cause inflammation in all these organs, and your whole body is rotting. Just like how in this particular picture, when you keep pushing all this rubbish into your room, your whole house is going to rot. It's going to stink. Now you know why, despite of how disciplined you are in terms of taking medication and insulin, you notice it will never help you. In fact, the more you take the medications, the worse it becomes. And there are also many supplements out there which is like that. I just cannot stop. I just find this kind of there's this advertisement that is so funny, you know. Yeah, okay. It takes an old man. There was an old man. I'm pretty sure many of you have also seen this advertisement. Okay, if you've seen this after this, probably you just put Y. Just put a Y. Just put a Y. Okay. You know, you know what they did? They take an old man. Okay, and of course they say the old man is diabetic, lah. Okay, and they just take the blood sugar. Okay, then after that they drink something. They drink something which is what they sell, the supplements that they sell. Okay, it's like a form of tea or something like that. They drink, and then after that the patient started eating durians. Okay, I think I remember there was one advertisement that is on durian. The other advertisement is on, I think, on some burger or something like that. Oh, the patient just eat it, and after that the test of sugar is normal. Wow, so happy, right? Come on, you know how stupid is that? You're pushing the sugar into your own body cells. How do you even think it can help you? All right. So, ladies and gentlemen, now you know why. Okay. Now you know why. Now you know why taking medication is so bad. Yeah. Someone is asking, just come to the point. Ladies and gentlemen, every single thing that we share in this talk is a point. If you miss any of the point, you won't get the point. Right? Because everything is a point. Because why? We believe in using education to empower you. So if you miss one part and you think that this is not a point, you will miss the entire thing. Okay, so every single thing is a point. All right. Can I just go to my medical school and tell myself, oh, I'm a very clever boy, you know? Can I just do the later four years of my medical study? I want to skip 1 year. You know, medical fee is so high. You know, I mean, even medical school fee is so high. You know? I want to skip 1 year. Can I? No, because the entire journey is important. The same goes to our talk. When we share from our heart. Okay, and we want you to know every single point is a point. Okay, so now, ladies and gentlemen, do you now know why medication and insulin is so bad? And if you still continue to take, okay, and of course, you cannot remove it on your own, you need professionals to help you, okay? But if you don't take any action to get professional help, nothing is going to change, okay? You are just rotting away, okay? Let's move on because time is running out.
So the next question is, can diabetic patients stop taking medications, supplements, or insulin? If you think that yes, diabetic patient can stop taking medication, okay, you can write yes for 7, okay? If you think it's yes, then you type 7. If you think it's no, then write 8. Right? Can diabetic patients stop taking medication, supplements, or insulin?
What have you been told by your doctors, right? Okay.
Once you're diagnosed with diabetes, can you really stop that? Or you need to take it for the rest of your life? Yeah, I don't. Maybe not only diabetes lah. Hypertension also applies.
Also, correct.
Hypertension also applies.
Okay, let's move on. Okay, so are we the first doctors in the whole world to come to know about this first? No, not really. We are also just a bunch of copycats. Okay. All right. What happened was I'm being inspired by this lady. Okay, her name is Dr. Sarah Horberg from the US. I stumbled across this TED Talk, okay, on YouTube. I love to watch TED Talk is because my passion is public speaking is my passion, and I love to watch these professional public speakers speak, you know, and I learn from them. And so if you're wondering how come we are good in terms of delivering messages, is because we are actually trained to do it. Okay, we are trained to simplify complicated medical knowledge. Okay, come. So it was written here, reverse diabetes by ignoring the guidelines. So the first time I heard about this was like, wow, this is a very daring and a very bold statement, you know. And I never learned this in medical school. My parents pay a few $100,000 for me to do my medicine, and I never learned this. Even my senior in the hospitals and the government never taught me about this. They told me diabetes is a lifelong disease, chronic disease. You have to take lifelong medication. So when I first came across this, I was very doubtful. So ladies and gentlemen, I understand how you feel, because exactly this is how I felt about 4 or 5 years ago when I first watched this. So if this is the first time you came across this concept of reversing diabetes, I understand how you feel completely. Don't worry about it, okay? All right, but I need you to stay open, because by staying open, you might just save your life, okay? And of course, the next doctor that inspired me is Dr. Jason Fong. So Dr. Jason Fong is a Canadian nephrologist. Okay, so why is a nephrologist doing in this field of reversing diabetes? Okay, you probably already know why. I already mentioned just now, about 70% of the kidney failure patients are due to diabetes. So he is a kidney specialist. And in his career, he has seen so many kidney failure patients. By the time they go and see him, it's too late. So he couldn't do anything. So he was trying to search for the root cause, and he found, oh, diabetes and hypertension is the root cause. Then from there, he was like, hey, how come these people who are taking medication insulin, in the end, why are they still suffering from kidney failure? So he dig very deep into all these conditions, and then that's how he found out about the root cause. And of course, now he's a leading expert when it comes to reversing diabetes, and I'm very thankful to him because I've learned a great deal from him. Okay, let's move on to the next one. So we have someone from the US, we have someone from the Canada. What about Malaysia? Are there any doctors in Malaysia other than the two of us here, Dr. Andrew and and of course, and Dr. Jasmine? Are we the only one who is talking about this? Who is this guy here? Okay, who is this guy? Can someone tell me who is this guy? Okay, this superhero of ours, okay, who has been, tirelessly helping our country to handle this COVID-19 pandemic. Okay, can someone guess who is this? Okay, we just need to have one answer, then we can actually move on. But I think we have to really pay our due respect to this superhero of ours, and he was also being awarded as the top 3 best doctors in the world when it comes to handling this pandemic. Okay, all right. Okay, I think due to time factor, I think we just move on. Okay, probably the answer will come in later. Okay, so pretty sure you all know who is this guy. Okay, so he is none other than Dr. Tan Sri Dr. Hisham Abdullah. Okay, let's take a look at what he actually wrote here. Individuals with diabetes are more likely to develop a more severe form of COVID-19. He said that, we didn't say that. The virus does not discriminate who it infects, include those with non-communicable diseases such as diabetes. Of course, it also includes hypertension and also obesity. And I'm not sure how many of you realize, right? Among the death cases, you notice that most of these patients are actually diabetic. Just take a look at this. This is in Bahasa Melayu, of course. Kencing manis. The next one is kencing manis. Okay, the death case number 533, kencing manis. Kencing manis. The whole list is all kencing manis. Do you even think that if you are taking medications and insulin for your condition, and if you happen to get so unluckily you actually got this infected with COVID-19, you think your chances of surviving is high? Or do you think only by reversing the condition, then only your chances are higher? So I need you to really think about it. Okay, all right. So let's move on. We also want to see what exactly he mentioned in his Facebook a couple of years ago. Okay, it's Tan Sri Dr. Hisham Abdullah, our DG. Not impossible means possible. That type 2 diabetes can be reversed. He said that, and cured in just 4 months by cutting calories, exercising, and keeping glucose under control. A trial has shown. Right? Okay, let's move on. Okay, so if you're thinking that, some people will be thinking, are you sure can or not? We are Malaysia's #1 and the largest reversing diabetes center. And the patients with the longest diabetes is up to 36 years. Look at this patient, Mr. Leong Kyun Sin, 74 years old Chinese gentleman. He is a diabetic since 1984, the year I was born. Yeah, I'm only 36 year young, okay? Okay, and he was on 98 units of insulin. Do you know that it only took us 4 months to reverse his condition? 4 good months. 4 good months to get rid of all this insulin. And ladies and gentlemen, for information, as of today, he is no more on insulin and his blood sugar is within good control. How many of you think that, it's pretty awesome, to actually get rid of this insulin and yet have a good blood sugar control? If you think this is pretty awesome, please comment there yes. Okay, please comment there yes. All right. Yep. Okay, let's move on. Okay, I think at this point of time, okay. All right. Instead of we speaking continuously, we would like to invite a very special guest of ours, okay, by the name of Mr. Simon. He is a former safety and health manager, and of course, he has been embarking on the journey of reversing diabetes program with us. And I think without wasting too much time, we are going to invite him on board. Okay, so ladies and gentlemen, please welcome Mr. Simon. Hello.
Hi, Dr. Andrew. And Dr.
Hi,
Jasmine.
Mr. Simon. Yes.
Thank you for putting me on board.
Yes. Thank you so much for spending your Monday night with us.
No issue. I can be any help. Sure. I will.
Okay. All right. Okay, so probably share with us. Obviously, you are diabetic. Since when you have been diabetic? Which year? Can you recall?
I was diagnosed in 2017. Is by chance, by chance.
What do you
My,
mean by chance? Sorry.
because I was supposed to apply for something and I need a medical checkup, and they check my
Oh,
urine, and
okay.
they say there's protein there. And then
Oh,
the doctor so happened to be my uncle's daughter, and she
uh-huh.
said, "Uncle, better you go for a blood test tomorrow, fasting glucose." So next day I
Okay.
went for HbA1c, and
Yes.
it was confirmed it was 9.2. I think it was 9.2. I think
Wow.
going back to the symptoms, what she mentioned, it has been
Uh-huh.
there for 2-3 years, but I've been doing a yearly checkup with
Yeah.
a doctor in a hospital, different hospital. I wish not to mention here, but
Yes.
it was I was taking HB1AC for the past every year, so there's a record for a few years, but
Yep.
never he mentioned that you are getting diabetes control or nothing, you're fine,
Okay.
you're fine, you're fine. So after that, I was straight away put on metformin twice a day,
Yep.
and I used to check. They did say check your blood to test, but I used to do my own reading
Yes.
every few days once, 2 days once, and it don't seems to be going down very low. It is just like always about 7, within 7 to 8.
Your
That's
fasting blood sugar.
fasting blood sugar.
Yes.
And,
Okay. Okay.
on top of that, I also uh, cut down on the sugar. Not completely, not zero sugar. Zero, I still take korang manis,
Yep.
and then other things I eat normal carbo and all those things. But cut down on the carbo also. It's not that full scale like last time.
Yep.
So it was never going down. It was always
Okay.
there. So since then, my doctor says, okay, you still quite control, but you try to control, try to be, careful on your food and all these things. That's the only advice I get
From your doctor.
from a doctor.
Yes. Okay.
But then when I come, the chance to the Facebook, I saw reversing by, reverse it. Because I quickly grabbed the chance and listened to Dr. Andrew Dr. Jasmine, and I made an appointment with Dr. Andrew to see him personally. That was on the 8th December. I saw him, and at that
Uh-huh.
time, when I see Dr. Andrew, my blood test was done 2 months before. That was October 2020. My HbA1c was 7.2.
Yep.
7.2, and then my weight was about 76.4 kg, I think.
Yeah,
So,
you're right.
so with the advice and guidance, Dr. Andrew, I started my journey to reverse my diabetes on the 9th December itself.
Uh-huh.
After about 3 weeks, I went back to see him. I am
Yes.
still on metformin. I still on metformin. Not only metformin, with 10 other drugs for my heart patient, because I was also a heart patient.
10 other drugs.
10 other drugs.
Okay.
And not forgetting, I'm a single kidney patient. My kidney, I'm born with one kidney. So
Okay.
I'm very, very well aware, because this diabetes is very dangerous if you don't take care, not treat it properly, your kidney will be affected.
Yeah,
So I'm
that's
well
right.
aware of that way before. So that's why I just jumped quickly and I started my journey. And after 20 days, my sugar level with diet control, all this discipline myself. And I remember this word Dr. Andrew said, no cheating. Diet. Okay, that's very important. That's very important when you start your journey in reversing diabetes. And my most of the time it come down to below 6.
Okay.
Below 6, my reading always below 6 most of the time.
All right.
Okay, and that has meant I was still on drugs, on medication metformin. Then the second session after almost a month, that was January 26th. But in the second section itself, Dr. Andrew already cut down about 3 or 4 medications. medication I cut on. After that, the second session itself, metformin is out, and it is now always within the range of 6, average 6, without medication, and cutting down all the blood pressure medication and all this. So I'm only now, let's say for my heart and generally overall medication, I'm only about 5 now. So
I'm looking at your record now. You are currently on 1, 2, 3. You're on 4 medications now.
4
at this moment.
medications, right? Yeah,
Yeah.
the one of it is twice a day. The size is 5.
Oh,
It's
yeah,
four-
yeah, yeah.
it's
You're
four,
right, you're
yeah,
right.
right.
Yes. What's the
It's
route?
four
It's
now.
twice a day. Yeah.
Yeah.
Correct. Yeah.
Metformin is also out totally.
Yeah. Metformin out. Yeah.
Yeah, my blood pressure, cholesterol, all are out.
Yeah.
I feel very, very energetic. I feel very good. And I don't go. I just listen these guys. I don't go to night toilets as often as I used to.
How often you go to last time? I mean, before you met
Last
us.
time at least 3 to 4 times.
Are you serious?
Yes.
Wow.
Now Two
Jasmine,
is-
you're muted.
2 is maximum. 2 is maximum.
Oh,
is maximum.
reduced already lah. Right.
Reduced.
Okay.
And my numbness, my legs all way go down already. I don't feel so much.
Can you
Wow.
share with us a little bit more about your numbness?
Numbness,
Because
I used
actually,
to have
remember-
like it's for your daily affair, everything there, like a burning sensation, my both legs, more towards
Both
on
legs
the
are-
left leg.
left
Both
are-
legs, but more towards on the left. I always check my legs, is there anything wrong, But I know it's related to diabetes, lah. But I always
Yeah.
check, make sure that I won't get any wound, my skin won't get darker and all those things,
Yes.
I wash my legs properly during all my baths. And then after this diet change and everything, I remember telling doctor my numbness all gone. I should say about 50 to 60% or 70% gone, and I don't feel it every day now.
Fantastic.
Yeah.
Ladies
I
and
don't
gentlemen, how many of you think that this is pretty awesome, for this numbness to disappear up to like 60 to 70% just in about a month plus, I think, right?
Yeah, month plus, yes.
Yeah, 1 month plus. If you think this is awesome and you would like to be like Simon, please please comment why and let us know that you're also keen, or interested with this kind of, improvement as well. Yep.
Yeah. So it's very worthwhile. You will be very happy. See. When you're happy, I'm very sure all your organs also will be happy. Yeah. Okay.
Yes, you are so right.
No stress. Okay. Because sometimes stress plays a part.
Yeah.
Yeah. So
Yeah.
I'm very happy on my way. And when I started the journey, I was, as I told you, 76.4 kg.
Yep.
Now I am. This morning I mentioned it. No, it's this morning it was 70 kg.
Are you serious? 70 so
Yes.
fast?
Yes.
Wow.
Because last week when I saw you, Dr. Andrew, it was 71 or something. Now
72.
It's
You told me 72 when I saw you last week. Yeah, on the
Yes,
27. You're telling me you're 70 now.
Yeah.
Wow.
So that is within the span of 2 months. That's almost
Yeah,
6
correct.
kg.
You started seeing me in early
6
December.
kg. Yeah, 6 kg.
Yeah.
I'm
Wow.
very happy.
Your ideal weight is supposed to be 49 to 61. So our
Yeah.
aim now is to bring you down to less than 61 kg.
Correct.
Yeah. Wow. Very soon you'll be there already.
Yeah, I'm very happy now. Thank you, Dr. Andrew, for your guidance.
Thank you, Simon, for also giving us the trust on this. I'm not just was just wondering, and you have any questions for Mr. Simon? Okay, feel free to comment. Okay, yeah. Why and very curious to find out more on this is this reversing diabetes. Yes, we'll be sharing more after this. So yeah. So any more questions for? Okay, maybe we can ask. I think many people are very worried when it comes to like whenever we talk about diet plans, right? Usually people are very scared, right? You're like, ayo, this cannot eat, that cannot eat, a lot of restriction and things like that. Simon, probably you want to share with us, what do you think of the current diet plan? Is it quite liberal? Like, do you have a lot of freedom and things like that?
I lost nothing. I eat better food now than last time.
You eat better food?
Yeah, I think generally for Malaysians, being Malaysians,
for you.
I think the carbohydrates are the favorite food, the tastiest food.
Yes.
Yeah.
You're right.
We,
You're right.
we don't realize that they are killers, they are killers. Not only diabetes, any other disease, carbo is very related. But I cutting down completely my carbo.
Yep.
I'm much feeling much healthier and lighter. I'm eating everything. I eat fat. I eat
Yes.
a lot of meat.
Yep.
I take a lot of vegetables.
Yes.
Yeah. So what's the deal? I lose nothing. In fact, I'm enjoying.
You lose weight,
Yeah, I
and
lose
your
weight.
sugar level has gone down, and then your BP
Yeah.
has gone to normal. So you lose weight lah.
Yeah, yeah. Thanks, Dr. Jasmine, reminding me. With my medication, my blood used to be, my pressure used to 120 plus, 130 plus, over 80, 90. Now without medication, my blood pressure is nothing more than 120
Wow.
over 80. Nothing.
Wow.
How many
Awesome.
of you think this is awesome? Like you notice, Mr. Simon just mentioned that without medications, he was even doing better. How many of you think this is awesome and you would like to experience what Mr. Simon is experiencing? Please comment yes. Please comment yes. Because you can see how Simon is sharing with his heart that, the joy that he has. And, now without medications, the BP is even lower and he's enjoying his food. Yeah.
Yeah. People might be wondering how old I am. I'm 65.
You don't look like 65, Mr. Simon. Aiyo.
Thank you for the compliment. I'm 65.
Okay. Right.
I'm very happy. Thank God I found this program, and I'm very happy. And thank God for my wife who prepares most of my meals. And not only that, not only me, my wife joined me in my meals.
Oh,
See, that's the
okay.
thing. Yeah.
Okay.
Only I feel bad. Hey, depriving you your favorite food. Don't worry, I'm happy. I'm fine. So,
Did your wife see
I
any
thank God.
improvement on her side? Like,
Yeah, she's losing weight.
oh, okay.
She's losing weight too, but she's not on any medication. Thank
Yeah.
God for good health for her.
Yes.
She's not on any medication. Thank God she's perfectly fine, but she's losing weight.
But was she overweight before that, or is she in a
No.
normal?
She was in the somewhere in the 50s only, mid 50s.
Oh,
Yeah.
okay. Yeah.
She's less than 5 years below junior to me.
Uh-huh.
And the other day is when I mentioned when I told you 72. She also she said, "Hey, I went down before below 50." She said, so she went down too.
Okay.
Yeah.
All right. Is she feeling the same result as you? As in, like, is she more energetic now as well?
Yeah, of course. Yeah, she's definitely feeling good.
Okay.
No complaints.
So, okay, just share with the crowd. Did I prescribe any supplements to you in this entire journey for the past 2 months?
I don't know. We're discussing about supplements or additional medication, this and that. We only discuss food. This is good. Take that. Don't take this. Don't take that. Only food. What kind of food to take? What food not to take?
Yeah.
This is no good. This is no good. That's all.
Right. That's right.
We don't even mention organic and non-organic. It's good.
Correct. What we really want is real natural food. Yeah. Yes. Yeah. Okay, that's good. All right. So probably you want to share one word of advice to all our friends here, today, because I'm pretty sure there are a lot of patients here who are diabetic, hypertensive, and they wish to be like you. Can you give them one word of advice? Like, what would you advise them to do?
My experience prior to this journey, the biggest problem was food intake. It's very difficult to avoid that, avoid this. But now, I should say we must discipline ourselves. Like Dr. Jasmine said, we must paradigm shift. Discipline ourselves. These two things. You change your mindset, I call it paradigm shift. Then you discipline yourself, and you will come out of it. With God willing, definitely you will come out of it.
Yeah. All right.
Thanks. You can call me anytime. I think in the WhatsApp group, in the Facebook thing, I can ask me anything, then I'll come back to you.
Yeah. Okay.
Thanks.
So, all right. Thank you so much, Simon, for joining us tonight. Okay. So
thank you for having me on board also.
Yeah.
Thank you so much for sharing.
Welcome.
Right.
Thanks.
God bless you, and we will see you soon.
Yeah. Good night.
All right. Thank
Good night.
you.
Thank
Good
you.
night.
All the best to the rest.
All right.
Please come
Thank
on board and don't say, I wouldn't say try. It definitely will work.
All
Yeah,
right.
I'm a good example.
Thank you. All right. Okay, how many of you think that what Mr. Simon experienced is pretty awesome? As in 2 months, can you imagine just 2 months? Okay, Mr. Simon started seeing me in December, early December. In 2 months' time, from 10 medications, I managed to remove half. Okay, from 10 tablets to only 5 tablets per day. How many of you think this is quite an awesome experience that Mr. Simon has actually experienced? And how many of you think that you want this kind of experience? And you notice Mr. Simon keep repeating, saying that, oh, I'm more energetic now, okay, and I'm happy, less stressful now. I'm eating good food and things like that. You notice these are the sharing that was shared by Simon with all of us. How many of you would like to experience something like what Simon is experiencing? Please comment yes. Why? Yeah, either yourself or for family members. And how many really think that, wow, this is really awesome and this is really what you want? You want life, okay? You want good life. You want an enjoyable life with as little medications as possible. Yeah. So if you are like this, all right, you are just like Simon, all right. You want to live your life to the fullest without all these medications. You want to enjoy good food, like what Mr. Simon said. Please comment why. Okay, let's move on.
So secret number 3 that we want to reveal is diabetic patients can stop taking medications, supplements, or even insulin.
Ladies and gentlemen, just think about it. Do not think that, okay, sorry, go back to this. Do not think that this is a small little secret. Don't even dream of one day that your doctor will share this with you. Your doctors will not share this with you. Okay? I'm sorry, your doctors will not share this with you. Why? Come on, they are the ones prescribing medication to you. Why in the world are they going to share this with you? If they are going to share this with you, it's just like slapping themselves, right? It's the same thing. They are prescribing to you and telling you that you have to be on lifelong medications. They will not be able to share this with you. But now you are being empowered. Now you know it can be done. Now you heard, okay, firsthand from Mr. Simon that from 10 medications, of course, we have not completely reversed his condition yet, but from 10, it already went down to 5 within 2 months. Don't you think this is very fast? Why do I say fast? Even if it take 1 year, don't you think it's fast? You know why it's fast? Because for many, even in their entire lifetime, they won't have an opportunity to get rid of medications. And for Mr. Simon, it was 2 months to drop 5 medications. Okay, I'm pretty sure probably in the next 2 months, okay, or maximum maybe 4 months, I will be able to hopefully, okay, drop off all his medications and he will no longer be needing any of the medications. Ladies and gentlemen, just for information, Mr. Simon is also on a blood thinner, and you know this blood thinner actually causes gastric. Therefore, he is also on gastric medications. Okay, I'm hoping one day I will be able to get rid of these medications for him as well. All right. Yep. Okay. Yeah. So somebody said yes, they want to earn more money. I think at this point of time, we really need to share with everyone, and I want to plead everyone not to place any blames on any doctors. They are my colleagues. Okay. We are in the same team. We are from the medical team. Okay. I don't want you to place any blames on any one of them. Let me give you a few reasons why. Number one, the secrets that we are sharing with you, we didn't learn this during medical school time. We didn't learn this from our professor, our boss, our head of department when we were in the government sector and things like that. So number one, we never learned. So it's not the doctor's fault. So number one, it's not the doctor's fault because we are not aware. Number two, even if they are aware and if they are under some employment, either with the government or the private sector, they won't be able to share with you because that is going against the guideline. Do you remember the first doctor who inspired me, Dr. Sarah Hobart? She's going against the guideline, ignoring the guidelines, reverse diabetes by ignoring the guidelines. We have to ignore the guidelines. We have to be very bold in what we do. If we are going to stay timid, okay, what we're going to do, we're going to just prescribe medications to you. All right, and Mr. Simon will not be where he is today because we will be no different from other doctors. So many of the doctors, they are timid and they won't be able to share this with you because they have a rice bowl they have to take care of. They need to make sure that their boss don't fire them. Okay, because they have to follow the protocol. The protocol is to increase the dosage of medication, not reduce the medication. So please don't blame them. of course, the last one, which is also not a very nice reason why you shouldn't be blaming them. Okay, someone already mentioned it, they want to earn more money. Most doctors, okay, depend on selling medications to make money. How are they going to make money if they don't sell medications to you? In Sweet Lives, we don't sell medications. We don't even sell supplements. All right? So, you have to understand this. So, you cannot blame them. And furthermore, they also don't have the time to educate you. Okay? I'm not sure, ladies and gentlemen, how many of you would agree with me that many a times when you go and see a doctor, right, you realize that you are spending most of the time in the waiting area. 1 hour, 2 hours, or even 3-4 hours sometimes. And then when you enter the doctor's room, you're only in the room for what? 5 minutes, 10 minutes. At most 15 minutes, you have to get out of the room, right? So you cannot blame them for not educating you, all right? For not sharing all these secrets with you. You just can't blame them. The system doesn't allow them to do so. So please don't blame them. And this is why we started Sweet Lives. Our system here is different. Okay, we use education to empower. Okay, ladies and gentlemen, for those of you who are still here, I really thank you. Okay, it's already 9:40. Okay, of course, we promise you we're going to end at 10 o'clock. Okay, but no stay tuned because we have more secrets that we want to share with you. All right, there are more things that we want to share with you. Okay, so how many of you agree that, you know, yeah, most of the time I call all these touch and go doctors. It's like just touch and then you go, touch and then you go. You're in the room for 5-10 minutes, you get some scolding. The doctors will usually scold and say, oh, no, your sugar is not well controlled. I'm going to add on the next medication. I'm going to add on insulin to you, okay? And you don't really understand what is going on, right? Yeah, but this is not what we do here, okay? Let's move on. Okay, and this one we already explained. Let's move on. Okay. Okay, let's watch a video first before we proceed.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide. The average Canadian will spend their last 10 years in sickness. Change your future at makehealthlast.ca.
Okay, let's go on. Okay, come. At this point of time, I was just wondering how many of you have really learned something today? And you wish to know what are the things that you can learn more. Okay? You wish to learn more and you don't mind us sharing more about what we do in Sweet Lives, okay? If you don't mind us sharing about what we do in Sweet Lives, okay, on how we can actually help you to reverse diabetes, after knowing that diabetes is reversible, please comment a Y now. Please comment a Y, a yes, okay? Okay, to give us the permission, to grant us the permission to share with you what exactly we do in Sweet Lives. How do we actually help patients and things like that, okay? So, if you want to learn more, okay, we have already shared with you, actually not just 3 secrets, okay? If you're going to just repeat the secrets that we've shared with you, number 1, what is the first secret? The first secret is that we diagnose diabetes 10 years too late. So if you want to diagnose diabetes earlier, you have to go and check your fasting insulin level. That's number 1. Number 2, you know that the medications and the insulin will cause more complications of the diabetes because taking medications and insulin is just like dumping your rubbish into your bedroom. The second secret. And the third secret you found out today, okay, from Simon is that diabetes and hypertension is reversible. Okay, Mr. Simon managed to bring down, okay, managed to drop, okay, managed to lose half of his medication in less than 2 months. Okay, and he lost about 6 to 8 kg, 6 kgs within 2 months, which is a remarkable feat. All right. So, yep, thank you so much. All right, for all the yeses here. All right, let us continue to share. All right, thank you so much. Okay, so this is who we are. We are from Sweet Lives International. Okay, you must be thinking why international? Because we are truly international. We have patients from Singapore, we have patients from UK, we have patients from the whole of Malaysia, Sabah, Sarawak, almost the entire Semenanjung has got our patients. Why? Thanks to COVID-19. Because of COVID-19, we started doing this online consultation, and this is why nowadays the borders, okay, geographical borders is no more a restriction to us. We can literally do consultation for patients anywhere around the world as long as you have internet connection. Okay, so if you go Google, you can find that we are Sweet Life International. I want you to take note of something. Check this out. 4.9 out of 5. This 4.9 out of 5 is not 10-20 star, 10-20 reviews. It's 173 reviews. How many of you think this is pretty awesome? Huh? Don't you think that? And I mean, come, if I want to ask my friend to even do some comments, how many friends am I going to have to help me to write, like to actually rate us like five star? You know, can't, right? These are all genuine ratings. 170 stars. Okay, it's 4.9 stars. All right. So we are very passionate about what we do. And we want to strive to do our best to help as many patients as possible. This is why you see ratings like that. How many of you think this is really awesome? If you think this is really awesome, please, just put a yes there. Just put a yes there, at least to, because what we do is hard work. It's pure hard work. Think about it. It's almost 10 o'clock now. And we are still sharing, you going all out to share as much information as we can with you. If you think this is pretty awesome to have a 4.9 star rating, please comment yes, okay? So this is where we are. We are situated in Kelana Square, which is actually right behind of Paradigm Mall in Kelana Jaya. But ladies and gentlemen, this is not the time for you to come and see us here. Everything is done online at this moment, okay, because of the MCO. All right, so over here you can see this is our entrance. Okay, of course now it's Chinese New Year coming up, so we have some decoration. We have our license up there as well. Okay, Dr. Jasmine, you can circle the license up there. Okay, thank you so much. Thank you so much. All right, okay, let's move on. Okay, so this is the main entrance that you can see. Of course, if you enter, obviously you have to scan the QR code and things like that. Okay, as we move on, let's go on. Okay, so once you enter, you will be able to see our testimonial board. Okay, let's go back. Our testimonial board. Okay, and just for information, ladies and gentlemen, some of you are thinking, how many years have you been in business? We have been in business since 2017. We started off focusing a lot on back pain and knee pains. Okay, so if you remember, we in Sweet Lives, we treat only root cause. So I don't know, among those of you who are listening now, how many of you actually suffer from back pain and knee pain? If you are a person like this, say yes. Okay, not only say yes, but you notice that the treatment that you have gotten right so far, right, not really bringing you anywhere. You are still having the pain. Once in a while the pain will still come back. You have to go for regular physio, chiro. You have to take painkillers, and then some people ask you to take some supplements, glucosamine, or even ask you to go for operation. And you are just so sick and tired of all this treatment. How many of you are like this? Can you please comment yes? Okay, comment yes. All right. Wow, okay. I think, yeah, there are some yeses. Ladies and gentlemen, in Sweet Lives, we only treat the root cause of back pain and knee pain. As of now, we have withhold our health talks on back pain and knee pain. Our health talk on back pain and knee pain is another 1 to 1.5 hours long. Why? Because we love education. We want to empower you. We want you to know what is the root cause of back pain and knee pain. Okay, so if you are interested with this back pain and knee pain talk, all right, stay tuned. Okay, we hope that when this pandemic is, of course, getting more and more slower, all right, with lesser and lesser cases, when they open up, we will start back our health talk on back pain and knee pain, focusing on the root cause so that you don't have to, keep going back to the doctors, the physio, the chiro, or whatever. Okay, all right, come, let's go on. So we also have a grocery section in our center. So why is there a grocery section doing in our center? We only sell healthy food for our patients. We have noodles here, we have berries, we have some coconut oil, we have some very good coffee beans. Do you know that, ladies and gentlemen, most of the coffee beans that you find outside, 70%, take a careful look of the ingredients and you will realize 70% coffee bean, 30% margarine, sugar, right? So for us, because we are aware of this particular problem, therefore we bring in our own coffee beans so that our patients can still enjoy a good cup of coffee. Okay, so we have our grocery section, which is what we call the sweet markets. We also do delivery. So actually, these few days, we have a lot of patients who actually spend a lot of money on our sweet markets to actually purchase some of the food that is good for them. All right.
Thank you. Thank you.
Yeah, thank you for those who have actually made the purchase. All right. Our waiting area, of course, is a very cozy one. All right, you can see the cozy sofa there, and we also have a few fishes there to actually enlighten you, to also bring down your stress level. We also have good music, okay, for you to wait. But you are not going to spend too much time here, okay? Don't worry, because in Sweet Life, most of our patients only wait for us 5-10 minutes. In fact, during this time, you don't even have to wait for us, because when I tell you your appointment is at 4 p.m., it is going to start sharp at 4 p.m. because it's online. All right, so there's no more waiting time. All right, so because it's online. Okay, let's move on. We won't have OKU friendly washroom because we know some of our patients have all this, you know, they're on wheelchair and things like that. Okay, come, let's move on to the next one. Most important, of course, how we actually do our consultations. Okay, let's take a look of the left side. If you're thinking, how are we doing our live? This is exactly how we're doing our live. You can see that, okay, there's a DSLR camera there pointing at me. Of course, this is how we do our online consultation. Of course, it's the same room which when you know, patients come for offline consultations, those who can come, feel free to come, of course. All right, you're more than welcome, but not now because now is during the lockdown. Okay, and of course on the right side there is Dr. Jasmine's consultation room. Okay, so, and you know what, our patients spend a lot of time in our consultation room, 1 full hour. Okay, all right. Yep, I think many people are very impatient. They're all asking about our consultation fee. We are coming to that very soon. This is our team. Obviously, we are not just 2 doctors. We also have our team. We have our admin team. We have our customer service team, sales team, and things like that. Okay, let's move on.
Our vision from Sweet Life is we want to help 10,000 patients to reverse diabetes by 2025. And our mission here, you realize that it is almost 2 hours, and every point that we have just shared, everything that we have just shared, we shared from our heart. Okay, and this is our passion. And our mission, we want to empower our patients via education so that they can reverse diabetes, because we know that education is very powerful.
Finally, let's take action now to reverse diabetes in order to regain the freedom of health. Once again, I'm Dr. Andrew.
I'm Dr. Jasmine.
From Sweet Lives. We are Malaysia's #1 and largest reversing diabetes center. We help patients to reverse diabetes in 6 months without using medications, injection, or supplements. Thank you and good night.
Good night.